Well, I know I have 2 knees, but I'm looking at our table here and I see 3 more knees just laying there on the table.
It's always good to have an extra just in case.
You never know when you're going to blow a gasket and need a knee replacement here. Let us get serious and introduce our friends from Orthopaedic Associates of Spartanburg. Let's see, Dr. Mary Black.
Great to
Doc,
see you.
good to see you.
Thanks for having us.
And Dr. Michael Funderburg. How are you, Doctor?
Good.
You are part, 10 surgeons and doctors now at Orthopaedic Associates?
Yes.
Correct.
You stay busy?
Trying to.
Yeah, especially this time of year.
Dr. Black, tell us your expertise, and then we're going to kind of move on with Michael.
I mostly focus on the outpatient surgical arena, mostly with shoulders, upper extremity, and knee scopes. But
And you
not
can
knee
do that as
replacements.
an outpatient.
Well, this is the kind of stuff we've been doing for 20 years. 20 years ago,
Really?
we didn't do ACLs in the outpatient setting, but now we are. And the technology of surgical field is continuing to improve, so more and more things can be done safely
Right.
as an
That's
outpatient.
because you feel, because I played basketball forever growing up, so it was always a fear. You blow an ACL, you're done for a while. Are the advances and stuff getting better?
Oh yeah, absolutely, and that's what makes it fun to stay in medicine, the technological
And
advances.
Dr.
Get people
Funderburg, you
back.
can thank us baby boomers for getting older. We're your best customers, you know that, don't you?
That's correct.
Well, tell us about a total knee replacement. What kind of person is a candidate for that?
Well, the patients that have fully or global arthritis within their knee and are failing conservative management are candidates for total knee replacement surgery. And there's a difference between totals and partials. I brought some models here.
Yeah, I'm a visual
show and tell.
learner here.
Right. This represents a complete replacement where the entire end of the femur as well as the proximal end of the tibia is completely replaced with a metal and plastic components to remove the arthritic change. This is more of a partial replacement where only one side of the
okay, that makes
femur
sense. Yep.
and one side of the tibia is replaced, a much less invasive procedure.
Yeah.
And this represents even more of a partial in that just the patellofemoral joint is replaced.
Right.
And these have become more and more popular as we've pushed all across the country to improve the quality of this surgery through minimal invasive approaches, the fit of the components with patient-specific and gender-specific implants, as well as the speed of the recovery with tremendous innovations in anesthesia with long-lasting nerve blocks, as well as intrasurgical injections of longer acting anesthetic medications, which have been a tremendous advance for us to keep the patient's speed of recovery at an optimum.
Because let's say I did this full one, when could I expect to be back at it, being active again?
We are, because of the fit of the components and the stability of the components anymore, we are immediate weight bearing that afternoon.
That afternoon, I go in the
Amazing.
morning, and that after, wow.
You don't ever do 2 knee replacements, the same surgery, do you?
We do.
You can do that?
We can do that, yes.
That's what I would want to do. If I was going to just get in, get out.
Well,
you know?
I think a lot of it is patient selection. Some patients aren't candidates to have both done at the same time. Some are. Some patients are candidates to have this type of surgery as even in an outpatient setting now, where they go home the same day.
That would
That's
be
amazing.
Yeah.
When you go in surgery, do you have, I'm just curious, I know you take x-rays and ultrasounds and things, but do you know specifically what you're going to put in that patient before you go in that knee, or do you have a selection on a table to choose from?
The computer navigation that we use now helps us to limit the guesswork.
I got it.
And so that
You pretty much know.
And really we're getting to where a very patient-specific and gender-specific implants are generated and made, and we are implanting those specific that are made for their need.
Right.
Well, we appreciate you explaining
Yeah.
it. The visuals made
Very
so much
interesting.
sense, and really, I can get my mind around it.
But the
Orthopedic
wonderful thing
Associates.
about this is that we are, 1 million of these joints are being done a year in the United States, and that's probably going to triple as the baby boomers get older.
You can thank me now.
And,
Yes.
and 50%, the studies are showing almost 50% can be done safely, comfortably, effectively in an outpatient basis where they go home with a home health. It's taken a tremendous amount of work and at Spartanburg Regional at Pelham Hospital.
Right.
Certainly want to thank Bill Hazen and his tremendous crew there at the Pelham AAC, as well as Interim Home Health. They've done a tremendous job
Helping them
in putting this program together that can be done very effectively with a lot of patient satisfaction.
Well, we've run out of time here. You're in Duncan, but let's mention the main North Grove Medical Center, Highway 9, Spartanburg. So
Right.
Duncan and Spartanburg.
Awesome. Orthopedic Associates, great people. Go by if you ever need anything. Thank you guys. We
Thanks.
appreciate
Thank you.
it. Enjoy your
Appreciate it.
weekend.
Thank you very much.
All right, we ate barbecue and donuts. Now it's time to be healthy with some watermelon.
Okay, I'm ready. Oh, dessert, that's dessert.
Dessert.
After a donut?
Yep. Next.
Right.